How would you briefly describe your project to someone unfamiliar with what you do?
Project Age Well is an enhancement of existing programming at Project Open Hand, which provides medically tailored meals and nutritional support for adults in the Bay Area living with chronic conditions or disabilities. We specifically are utilizing technology in our program to extend our ability to reach older adults in the area who are socially isolated, and we're also expanding our nutritional education programming to include all aspects of wellness in addition to food and nutrition. Specifically, Project Age Well is a 16-week program for older adults who are experiencing social isolation and nutrition insecurity with the goals of improving outcomes in both of those areas. We utilize 3 components in this program, the first being our medically tailored meals and grocery delivery or pickup. We also provide 16 weeks of interactive small group classes that focus on a variety of wellness topics and skill building. And we also have individualized sessions with myself, a nutritionist, and a care coordinator to provide support from the very beginning to reach the tailored needs of each individual client.
What is the why behind your project?
Project Open Hand's vision is health for the sick and vulnerable in communities in the Bay Area. And we recognize that older adults are disproportionately affected in this area. So we want to be able to provide opportunities to reach those who need to be reached and to provide the support that they need and meet them where they are.
What has worked well for your project?
Our project has worked particularly well in the areas of the provision of meal services. This is something that's really our bread and butter at Project Open Hand, being able to provide medically tailored meals and groceries in a way that meets the need of each individual client. We're very flexible in that regard. We have a great system for that. We also have a fantastic nutrition education curriculum and wellness curriculum that we've developed that has gone very well as a baseline, but we've also had the opportunity to really tailor to our client needs throughout the last year of implementation.
What are some challenges your project faced?
Our biggest challenge for Project Age Well has been recruitment. So we have established partnerships with referring providers in the community and our AAA agencies. But we still recognize that because we are targeting the most socially isolated of older adults in the area, that we are going to by nature just have a harder time reaching them. So we really try to focus on building those deep partnerships with our partner agencies from the beginning and establishing really solid pipelines for access to the Project Age Well programming.
How did you find appropriate partners/partner organizations?
Project Open Hand, we are very fortunate to have a broad base of referring providers and partner agencies that are addressing social determinants of health in our community. So we really have deepened the partnerships with them by being able to support the needs of a specific target population and have more individualized and heightened support for these individuals. So we provide an additional opportunity to partner. We've also had the opportunity to expand our partners. So an example in San Francisco is a partnership with Little Brothers Friends of the Elderly. They address the social needs, the transportation needs, all of these sorts of other needs of their clients, and they recognize the need in a nutrition gap and a food gap. So we're able to meet that need, and they're actually able to help us provide longevity in our ability to provide social support when clients wrap up our program. In addition to that, we also need our partners in implementation. And Project Open Hand has the benefit of providing meals and nutrition counseling in San Francisco and Alameda counties. Our third county is Sonoma County, and we don't currently provide meals in that area. So we've partnered with the Ceres Community Project in that county specifically because they have a background and just a stellar profile for providing medically tailored meals to that community.
What funding sources have you utilized or will you utilize?
So Project Age Well is funded entirely by the Administration for Community Living and our matched funds internally. And at this time, that's our only funding.
How will this project be sustainable once your grant period is done?
The great thing about Project Age Well is that it's a pilot project with the intention of building a more efficient and effective host agency at Project Open Hand. So Project Open Hand has a variety of contracts that are serving our existing client base. And a lot of what we're doing in Project Age Well, while targeted to our older adults in our current cohort, we want to be able to apply all of these service model aspects to our overall model at Project Open Hand. So we're gradually taking some of the curriculum, we're taking some of the nutrition counseling. We're taking some of the assessment that we're doing with our Project Age Well clients and rolling that into our fundamental programming at Project Open Hand.
What stakeholders do you need buy-in from?
So externally, we need the support and buy-in and clarity of what we're doing, and understanding from our partners in the community. We want to be able to establish those clear referral pipelines and just have them understand who our target audience is, what exactly we're providing, and feel compelled that this is something that can meet the needs of the clients that they're working with. And we also are looking constantly at the clients themselves. Once they are enrolled in the program, they immediately have a pretty extensive intake. And we not only tailor our counseling and our education, our classes are modified to meet the needs of the individuals, but also the cohort as a whole as they go through the program. So we're constantly modifying. Internally, we recognize the need for support from our various internal departments. Our IT department was pivotal in being able to set up our Zoom capabilities and all of the tech questions, automated text messaging that we need to support our program. We also need our ops team. They're already providing meals and groceries and distribution for our current client base. So to ask them to add on additional population is a pretty big ask. So we've needed their partnership as well.
What advice do you have for trying to replicate a similar project?
Two pieces of advice that I have for replicating a similar project. One would be giving yourself enough of a runway, enough timeline if you're applying for a grant similar to this. Make sure that you're building into your grant the time that you're going to need to adapt and modify a curriculum, for example. You're going to need to assess internally what your capacities are and build the partnerships with folks that are going to be able to fill the gaps where you're not able to provide a certain service. For example, if you are not a meal provider, who can you partner with? If you're not a social service provider, who can you partner with? And then also being able to develop the solid outreach plans in advance, the solid evaluation plans in advance. Getting all of that foundational groundwork, but then also really being able to pivot. Some things that just based on what you're learning from the population, whether it's that technology is not a unidimensional term, we need to respond to different levels of comfort with that with our clients, or if it's just pivoting because your clients right now feel a need to talk more about a certain topic than another. So that foundation and then the flexibility.
How do I get started?
Once you've conducted a needs assessment, a landscape analysis of what's going on in your community, you can establish those partnerships and again, provide yourself enough runway to develop a solid outreach, evaluation, and implementation plan and a plan for pivoting, and make sure that you have the staff capacity to complete this very intense, in-depth project.
What do you wish you would have known prior to beginning the project?
We would love to have had a deep dive beyond the statistics of what older adults in the community need. An example of this is that we found that when we were initially thinking we would develop cohorts that are based on chronic disease diagnoses, what might be more relevant is how people have a relationship with food or what their geographic needs are as related to food or other resources in the community. We find a lot of people who have patterns of emotional eating that they'd like to deal with. So we can focus our curriculum on that versus just specifically being chronic disease diagnosis based. So that's just an example of how we wish we would have known a little bit more about what we were getting into. We also wish we would have known a little bit more about how challenging recruitment was going to be. We thought coming in with this program, this is a clear need, there's a space for us. But because there are so many food resources in San Francisco, we can get muddy waters around what's appropriate for whom. And so really being clear about what it is we're trying to do.